So, hi guys, welcome. Today we're going to be talking about stings and bites. So, under stings, we're going to be talking about shortly about bee stings, and then for the bites, we're going to be talking about bites caused by rabid animals. So straight up, you go to bee stings. So bee stings, they cause a sharp pain followed by an intense itching. So signs may subside within a few hours, but in individuals who have hypersensitivity, so basically anaphylaxis may occur. So there's a short video we did about anaphylaxis. You can go and see how we get to be able to manage anaphylaxis. So some patients may experience delayed reaction, usually after 0 to 14 days. So straight up we go to bites. So bites by suspected rabid animals. So all mammals may carry rabies. So saliva from rabid animals contain large numbers of rabies viruses, which is inoculated through the bite or any laceration on the skin where the animal has bitten the individual. So symptoms may present as incubation period may be 1 to 2 months without the symptoms showing up. So initial symptoms include malaise, fever, headache, while other symptoms may include itching on the bite site, paresthesis, so full-blown illness manifestation with the encephalitis, which may be demonstrated by agitation and dampness. So there is also hydrophobia, which is characteristic manifestation of the form of the disease with agitation, while paralytic manifestation of the rabies is often missed. So how do we get to be able to diagnose the rabies? So based on high index of suspicion accompanied by the clear history of the stray animal bite and other physical findings and documentation of hydrophobia, so demonstration of basal ganglial lesions on MRI scans and autopsy findings help confirm the diagnosis of the condition. So how do we manage? So immediately you get a bite on the local area which the animal has bitten you. What are you supposed to do? First of all, you're supposed to irrigate thoroughly with copious amounts of saline or water. You'll be able to cleanse with soap solution. You're also supposed to debride the wound site, administer an antibiotic, and you're also supposed to administer tetanus toxide. You're also supposed to infiltrate the wound with rabies immunoglobulin so that you can be able to reduce the risk of it spreading all over the body. That is as a prophylaxis management. So, indication for a rabies vaccine. At what point do we consider giving a rabies vaccine? So, bites from wild animals. So, also bites from unprovoked domestic animals. We understand that animals at home, especially dogs, hardly would they bite you if they're not provoked. So, as a result of an unprovoked domestic animal, one should be able to get the vaccine. So bites from sick domestic animals, whether immunized or not. There's also severe injury or multiple or deep puncture wounds from the bite. And in case someone has received a bite on the head, face, neck, hands, or fingers, so laboratory findings of negri bodies on the brain of the involved animal and also persons at high risk of exposure to the rabies. So, immunization. What is the protocol for immunization? So, pre-exposure prophylaxis should be offered to persons at high risk of exposure, such as persons working in a laboratory setup, of which they get to encounter the rabies virus occasionally. So, animal holders and also wildlife officers are also supposed to get immunized on rabies vaccine. So, three full intramuscular doses of 1 ml on day 0, 7, and 28 should be given in the deltoid area. So post-exposure prophylaxis is previously vaccinated persons. So local treatment should always be given. So post-exposure prophylaxis should consist of two booster doses, either intradermally or intramuscularly on day 0, 3, of the halving of the vaccination while the last 3 years. If somebody has stayed for more than 3 years without being vaccinated, so you can get the dose on day 0 and day 3, either intradermally or intramuscular. So otherwise, you're supposed to get a full course of the rabies vaccine. So post-exposure, what are you supposed to do if a patient come already exposed with rabies? So first of all, passive immunization is supposed to be done, whereby human rabies immunoglobulin is given as a dose of 20 international units of 20 international units per kg of the body weight infiltrated around the wound. And also, you're supposed to give 20 international units per kg and give IM in the gluteal region, followed by a course of full rabies vaccine. So, intradermally schedule is supposed to give one dose, 0.1 mils, should be given at each of the two sides, either on the forearm, on the upper arm, on day 0, day 3, day 7, and one dose at the site on days 30 and day 90. I hope you've got me clearly. So intradermally, the schedule is supposed to be one dose of 0.1 mils, which will be given at each of the two sites, either on the forearm or the upper arm. On day 0, days 3, days 7, and one dose at on site on the days 30 and days 90. Also, we're supposed to give intramuscular schedule of one dose, 1 ml should be administered on day 0, days 3, day 7, day 14, and day 28. So all intramuscular injections should be given into the deltoid region. And in small children, it can be given anterolateral area of the thigh muscle. Thank you. One factor you should always consider if you're keeping animals that can be able to transmit rabies vaccine, it is advised that you're supposed to make sure that the animal you're keeping at home, it can be most pets that people put are dogs, so you make sure that your pet has been vaccinated on rabies, so that's to reduce the risk factors of one encountering or getting infected with a rabies vaccine. Another caution to take, at any given point a person has been bitten by an animal, you're supposed to seek medical assistance as soon as possible, because the condition, if not treated soon enough, it can actually be very fatal. So I hope you've learned something. Thank you guys. Have a nice day.